Thank you for joining Dollar Care Foundation. This is Consumers Dr. Bengala. Today I would like to talk about rising costs of healthcare, folks. Everybody asks me, how come the cost keeps going up and up and up? We have spent $3.8 trillion and it has surpassed the national defense budget for the first time. Why is it? Why is it? It's a simple. It's very simple, folks. Every time government has a new regulation in healthcare, it costs. Every time, every day, there's a new regulation for healthcare. I don't know why is it that we want more regulations. I would like to see completely transfer the entire healthcare to public-private partnership. How about that, folks, for a change? We build dams and bridges under the public-private partnership. Why can't we do it in healthcare? I wonder why. It's simple, folks. It's all politics. Controlling people. Same thing with any other issue. Having more regulations so they can control every aspect of the healthcare. Let's see what happens under the public-private partnership, folks. Instead of having Department of Health and Human Services under 100% government control, let's appoint Health Review Authority. Every state should have a Health Review Authority monitoring health insurance companies, monitoring health care facilities and doctors. Yes, Health Review Authority doesn't cost the government a penny. This is the beauty. It doesn't cost the government a penny. Public-private partnership. The board is appointed by the same and under the rules of public-private partnership. The board will oversee the insurance companies if they're doing a risk segmentation, which is a big thing for the consumers, folks. Risk segmentation is the only way you can lower the health insurance premium, which insurance companies have refused it so far to segment the risk into well category, at-risk category, chronic illness category, and catastrophic. 4 categories. And you'll be surprised, chronic illness category, which is like 12 to 15% of the population, 12 to 15% of the population, you know what their claims are? Almost half. Half of the claims are from chronic illness. If you segment those people, the insurance for the rest of the folks should be much cheaper. People at risk, if they don't take care of their health, if they have other conditions, they're at risk, their premium should be 10% higher. But well category, they don't see a doctor, they don't go to the hospital, they just do annual checkups. Their premium should not be more than $100. Not even $100. It should be a lot lower. But what the money saved should be put aside into the health savings account. That health savings accounts with a debit card will empower the consumers, folks. Coming back to the Health Review Authority by the federal government or state, the board is appointed by the public-private partnership. They will oversee every aspect of healthcare. How about that, folks? Which will not cost the government a penny. But our representatives in Washington, they refuse to do it. They would rather wine and dine with insurance lobbyists than we are the one who are putting them in Washington, but they wine and dine with insurance lobbyists. And they're on the side of the insurance lobbyists, folks. What a shame. What a shame. The elected representatives are not serving the people's cause, but they're whining with lobbyists in Washington. This has got to stop, man. No wonder the health care is going in the wrong direction. I believe the time has come. The technology is going to empower the consumer no matter what you guys do. Technology is going to change the healthcare as we know it. And I foresee a big change in healthcare where consumers will demand affordability, they will demand competition. Right now, with the managed care, there is more consolidations going on, hospital mergers, group mergers, which is not right, which is really against the principles of free enterprise. There's more consolidation in healthcare than anywhere else. We need to put a stop to it. We need to bring more competition and more transparency, folks. More transparency. We need more transparency in healthcare than anywhere else. I would like to see, even before you see your doctor or you have your CAT scan or MRI, go to the hospital, you need to know the cost even before you receive the care. That way, we can put a tab on the healthcare costs. Folks, this is the way to go. I would like to see public-private partnership in healthcare. Yes, time has come. With the telehealth, with telemedicine and technology empowering the consumer, I have no doubt, we will succeed in empowering the consumer rather than insurer. Thank you for listening. If you like this channel, subscribe, share, and we will see you in the next episode of Dollar Care. Thank you.